What to look for in a parotid surgeon. I'm Dr. Babak Larian for Center for Advanced Parotid and Facial Nerve Surgery. First and foremost, with any surgery, you want to find a surgeon that does more than 50 of these surgeries a year, right? And parotid tumors tend to be rare, so finding someone who does that number is a little challenging, but that's an important number for all surgeries. And this one, because this one is so technical, they have to be using facial nerve monitoring, EMG monitoring during surgery so that they can monitor the function of the nerve. You have to ask them how they reconstruct the area of surgery, be it a small reconstruction or a big one. How do they do it? If they don't do it for every case, then that's a warning sign. You have to ask them how they address the greater auricular nerve. Do they preserve it and try to dissect it out of the way, or do they just cut it? You don't want that nerve to be cut because it can be easily preserved. You want to ask them about Frey's syndrome and they have them explain it to you. See how their understanding is and ask them how they're going to prevent it by doing a reconstruction. You want to ask them about deep lobe tumors, how much of an experience they have with deep lobe tumors. If they can explain to you what first bite syndrome is and the timeline of its improvement, right? Usually it improves anywhere between a few months and a year. And then most importantly, you want to ask them about their experience with a facial nerve. What is the incidence of having facial nerve paralysis, um, permanent paralysis, and what's their incidence of having temporary weakness, which goes away. You want to ask them how they want to follow up this tumor that you've had, right? For some benign tumors that doesn't need to be followed up, but if you have a pleomorphic adenoma, then that should be followed up in 5 to 7 years to make sure it hasn't recurred. And these are the very important questions that you should be asking your parotid surgeon to make sure that they are up to par to do the surgery for you, the right surgery for you. If you're interested in clear parotid information, visit us at parotidmd.com. Be well.